Welcome to CRH Talk, where we feature rural health professionals and dive deep into prevention, treatment, and building lasting health.
Thank you everyone for joining CRH Talk. My guest today is the director of our Cancer Center, and her name is Jennifer Ball. And how long have you been with the Cancer Center now, Jen?
I've been with the Cancer Center since 2012, but with the hospital since 2005.
So you are just tried and true. She's amazing. I've gotten to work with her for the last 9 years since I've been here, and you're just always smiling and kind and a good team player. And
thank you. I'm going to come here more often and talk to you.
Well, it's true.
Well, back at you.
Thanks. But I brought Jen on here because I want her to talk about a couple things with the Cancer Center. They've got so much going on over there, but also they have their cancer event. They usually host one every year. But why don't you tell us a little bit about what you have going on this year?
Yeah. So this year we have a really fun event called Kilts for Cancer, and that event is going to take place on Saturday, October 1st. And we're trying to do something new this year. We usually do a breast cancer awareness event. This year we're trying something a little bit different. We're actually coordinating with the Highland Games that are going on that same day and doing a Scottish theme. So our biggest goal though with these events is cancer prevention and cancer awareness. So we'll have our cancer staff there. We'll have our two physicians and nurse practitioner, Dr. Thomas Reed, Dr. Bryce Lord, and Kelly Spychalski, our nurse practitioner. We'll have a band with dancing, free dinner and drinks. It'll just be a fun family event. And with our ultimate goal, cancer prevention and awareness.
Yeah. So if you wear a kilt, I hear
that's true. If you wear a kilt,
bonus points.
You do. You get a prize. You get entered into a drawing for a prize. So yes, wear your kilts if you would like, and just come enjoy the evening with family and friends and support a great cause.
Yeah. And if you don't have a kilt, I ordered one specifically.
Yes, there will be some that you can purchase for a small cost.
For $10, and then $5 of that goes back to the Cancer Center.
Yes.
So if you don't have a kilt, still come. We'll have them at the door. And if you don't want to wear a kilt, you don't have to.
Yes.
But yes, the Run for Hope is that same day in the morning.
Yep. The Cody's Optimists do that. And so yeah, just a fun Saturday.
And then the Highland Games.
Yep. And that's at the rodeo grounds, and our event is actually at the terrace, so they're right next door to each other.
Yeah. So you can actually come and park at the terrace, right?
Mm-hmm.
I mean, they're really close. Then you can just walk down.
I would say,
to the rodeo if you want to go watch or participate. I hear they throw tree logs and climb trees.
Yeah,
I've never been.
I have not either, but some of our Cody Regional Health staff have been involved, and I think we're doing it again this year. So.
Yes.
And how could we forget? The time is 5:30 to 8, so on Saturday, October 1st. So yeah, if anyone has any questions, they can reach out to myself at the Cancer Center or Ashley in marketing as well.
Who's the band who's playing? Is it Dystopians?
Yes, the Dystopians.
Okay.
And we also have a chance to win a trip to Ireland.
Yes.
And so that's a big thing. So you can purchase tickets for that. And the drawing won't be until March, so you have a few months, but the kickoff is starting now to purchase tickets.
We had Annalie Avery, our foundation director, on just last week.
Yep.
But she talked a little bit about the Ireland trip. But yeah, all those funds that we raise, all of this goes back to the Cancer Center, which is awesome.
And all the funds that are raised for the Cancer Center just really, truly go to a great cause. Patients, cancer is expensive, and there's a lot of other costs associated with it, even if you have insurance. So this money goes for wigs for patients. It goes for co-pays for medications maybe that aren't covered. It just helps so much. We use it for gas cards and meals and just really anything the patient needs to kind of help supplement. So it's just we greatly appreciate any donation we ever get to the Cancer Center, and events like this just help us, help patients.
Yeah. Maybe just tell our listeners or viewers what do we offer at the Cancer Center, and not sometimes we think about just medical oncology, which I know you'll go over, and radiation, but there are other things that we do offer that...
Of course. So the Bighorn Basin Cancer Center is actually the only comprehensive cancer center in our area. So the closest other cancer center that provides medical oncology, chemotherapy infusion, and radiation all in one roof is Billings. So a patient living in our community in the Bighorn Basin can come here and get everything they need for cancer care close to home. So we have medical oncology, we have infusion and chemotherapy, and then we have radiation oncology as well. So we have a state-of-the-art linear accelerator that patients needing radiation can have access to. We also have van service. So if you live a distance from Cody, we have complimentary van service that you can get picked up at your house and be driven to your treatment in Cody, and then be brought back home. So that's a great service that our cancer center offers. We have a nurse navigator. We do genetic testing. We just offer state-of-the-art treatments for patients. And again, just a reminder, you can come to the cancer center and get everything that you need here close to home. So
yeah. And maybe just tell us too a little bit about our providers and why they are kind of unique in what they do.
Yeah. So Dr. Thomas Reed has been with our cancer center. He's going to be with us for 2 years in January. He came from Indiana and just comes with a wealth of knowledge. He, again, is very much so into genetic testing, and that is great new research that is helping support our cancer patients, their diagnosis, and really getting patients to live longer because we have further testing. And then Dr. Lord, again, came from Washington. He's been here for 3 years. And again, these doctors are state-of-the-art as well and are specialists in their field, and we work together to provide the best treatment for all of our patients.
And we're partnering, I believe, I heard that our radiation department, our imaging department, is going to work with the cancer center and offer 5 free mammograms. So man or woman, you can get a free mammogram if you come to the event, and your name will be put in a drawing if you want to be put in for that drawing. But they'll be doing 5 of those again this year. And they've done that for the last 8 years.
Yep, I would say, So we greatly appreciate that as well. So,
well, Jen, is there anything else that you'd like to tell our viewers and listeners?
I don't think so. Just if you ever have any questions, we're available at the Cancer Center. Our main number is 307-578-2800. If you ever would want a tour or just have questions about the services we provide, we're here for you.
Yeah, it's a beautiful facility. If you haven't gone in, we are always needing volunteers.
Always,
always. Want to volunteer, I know that they have people who bake some cookies, or they run different labs, or they just sit with the patients. Just there's always opportunity at the Cancer Center. But thank you so much, Jen.
Thanks for having us.
Being on CRH Talk, and those of you who are listening or viewing, please subscribe, share a comment, and follow us. So share this with someone else that you love or know who could benefit from it. And hopefully we'll see you on Saturday, October 1st at the Terrace around 5:30 p.m. for Kilts for Cancer. We'll put all of the informational links below this video. Have a great day, everyone.
Thank you.
Thank you for listening to CRH Talk. Please subscribe, rate, or share this podcast. Check us out at codyregionalhealth.org and see what services we offer locally in Northwest Wyoming.